I-15 right now, and you know what? Erin Perlman went to the dentist the other day for the first time in quite a while. And I don't know if you knew this, but it's National Children's Dental Health Month, the perfect time to brush up on a few things.
That's right. How do you think he keeps those pearly whites?
The pearly Perlman whites.
Right? All right. Well, how do kids keep healthy smiles? My mom always made me floss, and I've kept that habit into adulthood.
Oh,
There's Josh Helmuth.
How do you like them pearly whites?
I see gingivitis.
Those look pretty good, actually.
A little chronic halitosis, to be honest.
The halitosis for sure. I can smell it here in the studio.
People are at home, like, getting ready for work and for school. Like, we don't want to see that, Josh. And why are your teeth pink? Erin, why are my teeth pink?
Well, Josh, you've obviously missed some places when you were brushing and flossing this morning. And that little pink tablet that we had you chew on is actually showing where you've missed.
And I swear, I brushed this morning. I even flossed. It's a little bit pink. It's in the ridges, though. It's really pink.
In those interproximal spaces, right? The places between your teeth. Did you floss, Josh?
I did. Evidently not very well.
Not very well. Okay. Well, sometimes a lot of people floss, but they forget they just put their the floss between their teeth. But one of the main things about flossing is really adapting it and curving it to the tooth like a C.
Let's introduce our little cutie pie here. This is Lauren, right?
Right. This is Lauren.
And Lauren, describe what Lauren has going on here.
Lauren, we've used a disclosing solution that actually changes the colors of the plaque. So the plaque that's older is kind of a purplish color, and the plaque that is maybe that she missed in the last 12 hours or so is kind of a pink. So we've kind of disclosed her with this solution, and what you can do at home is you can chew these tablets, and then you can have them brush well, chew the tablet, and then you can see what they've missed. So your kids can actually practice and realize where they're missing.
Cool. We'll let you go ahead and keep working on Lauren here. Dr. Logan here is with me, dentist extraordinaire. Thanks for having us here so early in the morning. Is this something you guys regularly do with children to kind of help them understand here's why you need to brush?
Absolutely.
Okay.
I think they do it every time they clean their teeth, don't you, Erin?
We try, yeah. We try to actually, because that's the one way that you can show them where they're missing. And you can see, if you get these bristles up at the gum line and really massage at that 45-degree angle, that pink and that purple is coming right off.
It's magically disappearing.
Magically disappearing.
Lauren, your teeth are turning white. It's amazing.
So it's a good tool for parents and for kids alike, and it makes brushing fun.
It makes it really fun. This is something you guys do regularly. What else do you guys do to make kids feel comfortable? Because I know for some kids, it can be kind of intimidating, kind of scary to come into the dentist, right?
Absolutely. Our hygienists are great, and so they really help the kids on their initial visit feel comfortable. And if the first visit is really easy and nice and pleasant, we find that coming back's easy. And then the more frequently they come in for dental exams, the less cavities they have. The cleanings are easier because it's not so involved to...
I feel like when you're a kid, too, it's like a trial run, because if you get cavities, you're going to lose those teeth anyway. This is like your test, all right? But it's not your final exam. When the adult teeth come in, that's your final exam. Yeah, unless you want to spend a lot of money to fix them, which I had to do one time. Guys, don't go anywhere. We'll be with more kids here at Capitol Dental here this morning. Again, going over healthy tips and trying to learn more about how to make kids feel comfortable as they go to the dentist in honor of National Children's Dental Health Month.
Josh, can you have that little girl wave, please? She's the cutest little girl I've ever seen at 5:18 a.m.
Oh, they want you to wave, Lauren. They want you to wave.
Look how cute she is.
There
and
she
I have
is.
to say, Erin is awesome. She's our favorite guest of the week.
Yeah, she's like, well, Josh.
You think so?
Yeah.
She's like, well, Josh, listen up.
I don't even think she's had coffee yet this morning, guys. She has 3 kids. She's ready to go.
Good for her.
Let's do this.
She's awesome. All right, Josh.
I call her a superstar. Yeah.
She is a superstar. We'll check back in just a bit.
5:37. The ADA is sponsoring a National Children's Dental Health Month right now. And leave it to Josh Helmuth to track down a local dentist to find out what they're doing to help out the kiddies. Josh is in Southwest Bakersfield right now. Josh, let's see those pearly whites. Yeah.
What's up with his
I
tongue?
brushed.
Look at his tongue.
You did brush.
I had to get the pink dye all off, you know. Oh, my tongue's still pink, isn't it? Well, you know, I brushed my tongue too, but there's only so much you can do. What are you going to do? What do you want from me? Twist and shout, by the way. I have so many Beatles favorites. It's not even funny. Anyway, Erin here is still with me at Capitol Dental this morning, and this time we have her other daughter, precious little Taylor, this time.
Right.
And this segment, we wanted to find out the proper way to floss. How do you teach the kids the proper way to floss?
Well, obviously dexterity is always an issue, so we want to make sure that we make this as easy for them as we can. Ideally, what I like to do is I like to show them what the floss is and put it in their mouth and let them practice. But dexterity, like I said, is an issue, so we also have these little these little aids, floss aids that they can use. And so Taylor, you want to watch what I'm doing here, and you can just show them that when you're flossing, the number one thing is you want to kind of gently glide it in, and then you want to curve it like a C around the tooth and go up and down, working in and getting rid of that plaque and bacteria that's accumulated between the teeth, because that's where we tend to miss. And then you want to adapt it to the other side and do the same thing. Do you want to give that a try, Taylor? You want to hold that right here?
You got to be a special person to really be a hygienist, don't you? Is digging around in people's mouths.
Type A personalities are welcomed, that's for sure.
In a way, you're kind of like a paleontologist or something, right?
You're going for
digging.
gold.
You're just
going for gold.
You know, we have a real dentist in the house with us right here. We just spoke to you a few minutes ago, but again, kind of show us what else do you guys do to make the kids feel comfortable when they come in? It's National Children's Dental Health Month. Want to make sure they get a good start by developing good habits, right?
Absolutely. Well, our hygienists, as I said before, are great. And we just try to make the first visits really easy and nice. It helps if there's not a lot of cavities and procedures to do.
Yeah, not a lot of drill noises.
Exactly.
What do you guys do as far as, or I guess my question would be, what do you see the most of when it comes to dentistry in children? What are the most common things you really have to point out?
Just brushing and flossing. I think
Just
kids
very standard stuff. Okay.
Yeah, kids don't floss enough.
Okay.
And also diet. You know, with our diet nowadays,
Lots of sugar.
sodas,
Yeah,
and
yeah.
lots of candy. You know, and if we can limit that, it'd be much better.
Got it. It makes sense. I mean, honestly, I
mean, everyone knows that.
yeah, I don't think I ever flossed as a kid. And then when I finally started as a teenager, I'm like, why are my gums bleeding so much? And that's actually pretty common, right? So your gums get used to it.
Absolutely.
Yeah. So.
And it goes away pretty quickly.
Yeah.
And if you can start them at this age flossing, it'll pay big dividends.
Really? Got it. Yeah. Don't procrastinate, kids, if you're watching. It'll cost you a lot of money in the future. But don't go anywhere, guys. We'll be talking children's dental health the rest of the morning in honor of National Children's Dental Health Month here from Capital Dental. Taylor, another great model. Great job, Taylor. You're awesome.
Have her give us a little wave.
High five. Yep. She has some cute kids there.
Yeah,
Adorable.
yeah, they're great. We actually still have to introduce you to one more, actually. So.
All right.
Another daughter?
I know. This time we'll have her son
Oh,
on.
okay. All right, cool.
The
Josh.
eldest. Yeah.
Eldest. All right.
That's right. I'm brushing up on a few things right now, sending out Facebook messages. Kids are trying to keep healthy these days. Flossing, mouthwash, brushing. Sometimes it's tough to do. Josh Helmuth is live at Capital Dental in Southwest Bakersfield. Actually, Linda's dental office.
That's where I go.
Right?
Our executive producer goes there as well.
Wow, it's an
very popular.
Eyewitness News dental office over there.
I'm afraid to smile now because I had that pink stuff on earlier.
Let's
People
see
tuning
it.
in are like, "What, Josh?"
Teeth look good. Let's see your
it
tongue,
gone?
though. Let's see your tongue.
I'm not gonna show my
yeah,
tongue.
we can
No,
see
it's probably
it.
still
It looks
pink
like you
too.
ate a big red lollipop.
I know, I bet. We did a demonstration earlier for those just watching on how you can tell if you didn't brush well enough. Evidently, I didn't floss quite well enough. I don't know. Erin here is with me, dental hygienist extraordinaire. Now, something you guys do, it's National Children's Dental Health Month.
Right.
One thing you do that's common with kids is actually putting on a sealant. Show me what a sealant is.
Well, a sealant is a protective plastic barrier that we actually kind of paint over the surface of the tooth. This is kind of like showing that this is an antacid that's dissolved in actually vinegar. And then if you just put a barrier over that antacid, and you can put it in the same vinegar and it's not going to dissolve. And that's kind of the principle of how a sealant works. Okay. So what we do.
We all know kids can be prone to cavities.
And they, you know, their dexterity is not great. They don't brush well. 2 minutes of brushing for them is a century.
Now this just looks like Elmer's glue,
Like
but it's not.
And you can see that it's flowable, and it can actually, you can paint it on, get a real thin layer, and then we just put on this blue light. It's absolutely painless. It's so easy to do. We prep the tooth, we get it ready, we clean it off, and then we put the sealant material, cure it with our special blue light. Look away,
Yeah, don't look at the light. Don't look at the light.
So, and then it becomes hardened, and once it hardens, after about 30 seconds, Josh, what you're going to get is something similar to this, and it's like a little protective layer.
That is so cool. It feels like a chip from a tooth.
It feels like it's just a little tooth-colored layer. It's kind of a milky white, so you can see that it's there. And on Colin, he actually has some sealants in place. His are a little old. His are probably almost due to be replaced, but you can see that I can just pop this right off my glove.
Now, what age is appropriate to possibly have this done?
Most insurance companies, we would seal baby teeth if we could get away with it.
Really?
Yes, because
Okay.
kids just don't brush well. And it's a disease. I mean, dental disease it makes kids not concentrate in school. It's really great to have them. These milky white things on the surface of the tooth, this isn't Colin not brushing well. These are sealants that we've placed. Now, you can see that he's been grinding them down, and truthfully, some of these could even be replaced. I did do his premolars, his baby teeth, but
The advantage of having a mom as a hygienist.
definitely works for him. Definitely works for him.
He's used to having fingers in his mouth, right? Yep.
Exactly. And then, you know, we could do, when kids are 6 years old, 12 years old, we definitely do those permanent molars.
Got it. Thanks a lot, Colin. Dr. Logan here is with me. Advice for parents. Maybe they have kids, they're getting their teeth in. What would your advice be for new parents, especially with kids that are, you know, it's about that age where they have to go to the dentist for the first time?
Well, I like to get the sealants on the teeth when the first permanent molars come
Really?
in, about 6 years old, and then again at 12.
Okay.
But I wanted to say, I was talking to Erin, it's really no substitute for brushing and flossing.
Right.
It's
yeah,
not.
That's a good point.
It doesn't.
I'll just take the
Cure
sealant,
everything.
hold the Colgate and the brushing, the flossing. I just want the sealant. Just get, yeah.
Exactly.
Bad idea. Yeah.
Exactly.
What do you guys do? My last question. What do you guys do to make kids feel comfortable here? Because it can be scary when you're a kid going to the dentist for the first time, right?
Absolutely. We try to make the first visit very easy and nice and uncomplicated and quick.
Okay.
We find that if it goes pretty quickly and there's not too much going on, they have a good experience and they're more likely to come back.
ADA is sponsoring National Children's Dental Health Month right now, so leave it to Josh on the job to track down a local dentist to find out what they're doing to help kids locally. He's live in Southwest Bakersfield right now with one heck of a smile. Good morning, Josh. How are
Oh
you?
my gosh.
Good morning.
Good morning.
How's
are
it
you
going?
doing?
I couldn't help myself. I'm sorry. I'm so immature. You know, Erin, I was told long ago, if you treat the kids like adults and adults like kids, you'll never lose.
You'll be fine, yeah.
There you go. Well, we're here at Capitol Dental this morning. It's National Children's Dental Health Month, so we wanted to make sure we kind of showcase something to make it not so scary for kids and make it, you know, clear that it's very important to come into the dentist. Our last segment here, you have some great little items to showcase on how to really make sure kids have good teeth right away. Like what is this? What do we have here?
Well, some of these things are for protection. Kids are, you know, childhood's dangerous. It's, you get kicked, bumped, hit in the face, fall off your bike, things like that. One thing we like to see kids do, especially our kids that are in sports, is wear mouth guards, athletic guards. This is actually a night guard or a bruxing guard for an adult, but the mouth guards work in the same principle. And there's a lot of methods. You don't necessarily need to come into our office and have them done here, but what you can do is you can get them from the store. It's called a boil and bite, and where you just put them in hot water, get them kind of soft.
Oh, I use that for JFL, the Junior Football League growing up. Yep.
And they really make a difference. And with the kids with mixed dentition, we really don't like them to wear them for more than 2 months because it can hinder eruption of permanent teeth. So after about 2 months, you throw it back in that hot water and you rebite into it. Get a new one.
Rut-row. Got it.
Yeah. And then the other thing, you know, a lot of these little guys really are going into, it's something that you want to kind of keep an eye on for interceptive ortho.
We have football in the mind now. Interception!
Exactly. But interceptive ortho, at about 7 years old, we can kind of see their bite developing, their classification of occlusion, if their jaws don't fit together well, and we can kind of intervene and help guide teeth in correctly. And there's a lot of different options. You know, we have traditional ortho here, we have Invisalign.
Yeah, I've noticed Colin, your son right here. Step over here, Colin. Colin has braces on his top teeth.
Right.
What was your decision in doing braces or Invisalign in that?
With him, he's interceptive. It's a totally different track where Invisalign's really not an option, and he had some things that needed to be done, some extractions, so that we could get some teeth to erupt properly. He'll actually get his off soon, and then go into another phase later.
You look great with braces.
He does.
Very nice. Dr. Logan's over here with me. And Dr. Logan, before we close out here, any last words of wisdom from a dentist to the parents out there with kids?
Just really brush and floss twice a day. Kids always tell me, oh, my mom didn't tell me to brush at night. I'm like, well, you know, I'm sure she did.
And I've also...
So if she didn't tell you, I'm telling you right now.
Got it.
Brush and floss twice a day.
And at what age should you start?
Possibly
You should start flossing right away too when you're a kid. Okay.
Absolutely.
And I've also been told that you want to go soft brush, not medium or hard.
Correct.
Really? Okay.
Soft brush.
Soft brush does the same amount of work.
The plaque that you're taking off is really soft, and
Okay.
so it'll get.
And is
it
it
off.
beneficial? I was told by a few dentists to do this because for people that are more cavity prone or pit prone, if you will, to after you brush, don't rinse. Just let it sit in there and let the
That's a good option.
the sodium, not sodium chloride, that'd be salt. The fluoride, thank you. The fluoride just kind of sit there.
Absolutely.
Okay.
That works.
All right. Cool. Erin, any last words of wisdom from the dentist office to the parents at home?
Not at all, but any questions or concerns, you can always find us on our Facebook page or at capitaldentalgroup.com. And, you know, we're here for you 7 days a week. And
Now, your girls look like twins. I'm going to guess. Hold on. This is Lauren.
this is Lauren.
Yes! I got it.
Good job.
Lauren, are you afraid of the dentist? Nope. She knew right away. No, she's not afraid of the dentist. No reason to be right.
No, too much fun around here.
They have fun around here, if you haven't noticed.
Very cute little kids. Thank you very much, Josh.